Hey everybody, David here with the Plant Medicine for PTSD podcast, or as today's guest would probably want me to say, the PTSI podcast. That's because my guest today is Dr. Eugene Lipov, and today's interview was awesome for me. I hope this is going to be as fun for you to listen to as it was for me to record. I say that because my medical brain took over a little bit, and we kind of got into the weeds of honestly a debate that's going on right now in the medical field around the mechanism by which a stellate ganglion block actually works and actually helps people. So if you don't know, Dr. Lipov literally pioneered this treatment for PTSD. He's a pain management doctor, and I'm sure he would not maybe characterize it this way, but sort of stumbled upon using the stellate ganglion block procedure to treat PTSD. And like I said, he really pioneered this stuff. He published the first papers on this, I believe, in 2007 or 2008. And ever since then, he has been at the cutting edge of developing this treatment for use in veterans, first responders, other types of trauma survivors. He's been at the forefront of getting this recognized as a very legitimate and very effective treatment option. And honestly, it's really cool for me to have him on now because, as you'll hear him explain, he predicts that this year, 2026, is going to be the year that this really explodes onto the mainstream because of some research that is being conducted right now, where the results, like we already know that the results are going to be excellent, but the studies are being conducted in such a way to actually show precisely what is happening and in such a way that can't really be argued. I really enjoyed speaking with him. He's an awesome dude, like such a lovely guy, such a funny guy. Not what I was expecting at all. And you'll hear me at a couple points. I was almost getting worried because Dr. Lipov talks a lot about the biology of PTSD and the biology of healing from this trauma. And if you know anything about us, I really don't go too hard into, or I'm sorry, I don't go too far into like the hard neuroscience side of things when it comes to microdosing and psychedelics. Like Dr. Lipov and I talk a little bit about the default mode network. We talk about what psychedelics do, but I don't worry about that so much. And it's funny, I bring this up too with him. I used to wonder this about myself back in physical therapy school when people would be talking about cellular mechanisms and they'd be talking about like very specific effects on different structures in the body that we can have. And I just never cared that much about it. I was like, what do I need to do to make somebody feel better? Can we just do that? Can we just worry about what actually makes someone feel better? And part of it was perhaps laziness because I didn't see the value in tracing the thread on like every little tiny detail. But also I think, we learn about the biopsychosocial model, and I just didn't put too much emphasis on the bio part of that. And so I was worried that Dr. Lipov here was focusing strictly on that, but no, this dude also believes in ethereal planes and different stages of consciousness and different realms of reality. And I mean, his new book coming out is literally called The God Shot. So this is not a dude who strays from the spiritual side of things or from the inexplicable side of things, but rather he's just someone who applies scientific rigor to the things that we can actually talk about with scientific rigor. So I really respect that point of view from a clinician and a researcher. And at the end of the day, this dude's fucking helping people. Like I can't think of too many medical doctors that I can really say that about in this world of mental health and trauma recovery. So I really, really loved this conversation. Hopefully this podcast raises some awareness in you that the stellate ganglion block procedure is a viable option for a lot of people. As I mentioned to Dr. Lipov here, we've had a bunch of people in our program get the stellate ganglion block procedure and then come into our program for all of the follow-up that needs to happen on the back end of that to make sure that this procedure is part of a life-changing era of somebody's treatment. And it's not just providing a short respite, but then the person kind of goes back to a lot of the things that made them sick, for lack of a better term, in the first place. So I could go on and on about this. I think I've probably said enough to set up this conversation. Um, I'll stop there. Let's just get into this. Enjoy this episode with myself and Dr. Lipov, and I'll catch you on the other side. Perhaps we can start by you telling me about the background behind you there, because we've got an awesome, like, Chinese looking figure, and we have a little gong. What's the significance of this? I love it.
Well, this is my wife's stuff, actually. She
Oh,
loves
okay.
Oriental, beautiful. Well, I love warriors.
It's
This have
beautiful.
it's ivory. I mean, not
Oh, it's amazing.
yeah. So it's gorgeous. It's very old, and it's very reverent, I think. So
Yeah.
some people will have like a brain pictures, but it's all shocking. The idea when I like to have people look at it, calm down, right? I mean, it's like I don't want I like non-triggering environments, something beautiful. This is a gorgeous sculpture made out of ivory. It's just beautiful to me. And I do talk to a lot of special forces and military personnel, and I think a lot of military personnel enjoy kind of old history, like why people have swords and that kind of stuff around. So that's
Hmm.
something to me like that. That's all. It just yeah. It's
I like it.
not own any of that. That's my wife's thing. But it's gorgeous. No, I appreciate it.
I appreciate it too. I also live in a house where my wife has decorated pretty much the entire thing. I get to make very few decisions about what goes on walls around here. I think that's normal.
Yeah, when I met her and she found, when I had my apartment, she said, "Oh, you have empty walls. We will fix that." I was like, "I like empty walls." "Oh, no, no, we take care of it. You cannot have any empty walls." It's called to
My
like, do you have to
my
have
wife is obsessed. My wife is obsessed with floating shelves, like these two
yeah.
behind me. This is my job, is I install floating shelves. And I joke with her. I'm like, oh, there's 3 inches of wall space over there that doesn't have a shelf. We got to correct that. She's
You
gonna
know,
edit this
be
podcast and she's
be
gonna be mad at me.
careful. Be careful what you ask for, buddy. You may just get it.
I know. I
I
mean,
mean,
in her defense, it looks beautiful. It's a great
that's
shelf.
great. Although
All
I
right.
gotta say that cheetah or whatever, that's very spooky. It's looking through my soul.
Oh, it is. So this was painted by my friend Damian Robertson. He's a tattoo artist and a Canadian veteran. This was a vision that he had during one of our ayahuasca retreats. And he
Wow.
saw this spirit animal that was there protecting him and guiding him. So yes, it is a little spooky, a little ethereal, but I love it. It's a reminder of the ayahuasca and using the
That's
plant medicine to help
a
people heal.
It has meaning. Yeah. No, absolutely.
Yeah.
Think
Yeah.
though, I think visions can make a huge difference. So I'll tell you one thing that's kind of made a huge difference in my life
Please.
is so I had an out of body experience. I got hit by a propeller blade and I lost half of my blood volume in about 10 minutes.
Damn.
So that completely reorganized my thinking. Right. So I lost my fear of death. I was very much an introvert. You may notice I'm not much of an introvert now. And then it gave me a much more, I think, more relaxed view of the world.
Hmm.
And then I had a psilocybin experience. I didn't think it has that much an effect on me, but it was an interesting experience. Like I was in a beautiful gold spaceship flying through very geometric space.
Okay.
Interesting. I mean, a lot of people describe that, but it was very, very calming. But the most comfortable thing I have ever experienced was being out of body experience. That was
Hmm.
crazy.
How old were you when that happened?
22. I was the
Wow.
only reason I survived that experience. So I get a lot of this story. So I'm snorkeling, right? And the guy was a little drunk in Mexico and he came through the buoys. He hits me. I get knocked out and I'm smoking and there's blood all over. So I was about in the tunnel for about a minute. Then I come out for air and the guy's looking at me bleed. It's like, yeah, whatever. So I crawl in the boat and I had a lot of medical experience by that point. So I put pressure on the bleeding wounds. They almost killed me in the hospital a couple of times by
Sounds
intervention.
like Mexico.
Yeah, did not succeed, I might say. And, but there was if you find out what you're like under extreme stress, I don't recommend this, but I got to see what I did under severe stress. I stayed calm, my
Hmm.
training, and I was able to control the bleeding until the surgeons could operate on me. But that was a very interesting, very humbling experience.
So I carry everywhere that I go in my fanny pack. I carry a tourniquet and quick clot and pressure bandages and gauze. So I'm prepared to treat massive hemorrhage all the time. My wife gives me so much shit. Like, why are you carrying all that around? I'm gonna tell
Okay,
her
can
this.
I tell you an easier way to do it?
Go
I
ahead.
walk
What?
around with a belt that
Yeah,
has a clip, right? I don't carry anything else. So if
fair
something
enough.
that belt is a great tourniquet. I
What if
can
two
always
people are bleeding, Dr. Lipov, and you've got your belt and I've got my tourniquet and now we got it covered? You're
let's
like,
avoid
okay.
this. Let's avoid this. Okay.
Fair enough.
If it's happening, I'd rather watch that on TV than actually experience it.
I know. I had a phase. My background, I'm a doctor of physical therapy. We had some emergency medical response courses in grad school, and I had a phase where I was paranoid about school shootings, and so this was my response. I started carrying medical gear everywhere, which is not an unfounded fear in the United
No,
States.
no.
So,
I think it's realistic. I mean, it's like I've had to resuscitate people where they were bleeding.
mhm,
It's amazing. So this guy was shot in the groin. It's amazing how well my elbow worked. Just
just
as
to
long
to apply pressure, you mean?
yeah, yeah. It's I mean, I was just doing
Yeah.
that as I was
Hmm.
calling for ambulance. I was like, okay. He's like, get off me. I was like, would you like to die? No, stay quiet. Anyway, but the point is, if it stops bleeding, you
It
don't need,
works.
you just need the pressure in the right spot.
Right. Right. I think you're correct though. Let's just try to avoid all
Yeah,
such
yeah.
situations.
That's my younger years when I was doing that. Now I prefer to just talk about it instead of
Yeah.
experience.
Well, I actually had one other question about your younger years. So you grew up in the Ukraine, right? When it was still a
First year.
Soviet country. We have one of my clients, she grew up in Soviet Russia, and she always jokes about, like, when she shares her backstory and where her trauma comes from. It's like, I'm Russian. That's my trauma. So I was just wondering if, like, your experiences growing up there influenced the path that you went down or anything like that, or if you're laughing, so
Okay.
maybe.
Yeah, was yeah. So my grandfather was living in Ukraine. I was then, he almost got killed a number of times. So that trauma goes through multiple generations. So my father was involved in World War II. He was a
Mm,
flyer. Out of 10,000 flyers, 100 made it home. So he was a complete disaster and came home. So he gave that trauma to my mother. It's called secondary PTSD.
yeah.
So I eventually took her life in the United States.
Oh,
So
wow.
I was 6 years old when I left Ukraine. Then I lived in Moscow, which is Russia, from 6 to 14. Um, it's a pretty brutal, it's like when I came to this country, schools are very different than Russian schools.
Hmm.
They, I mean, basically, if you think of a military school, that all the schools are like that. Like, for example, in the second grade, I was being trained the design of grenades, how to throw grenades, how to put together Kalashnikov, all of that. You're
Wow.
like, what? Well, I mean, it's a different environment. In order to
Yeah.
pass a grade, you have to do a mile or a kilometer on skis at a certain pace, right? I mean, it's different. So honestly, I am extremely proud to have both backgrounds. I think Russia
Mm,
has some things to offer. United States has something to offer. Uh, the clarity of what it's like to be a male in Russia, yeah, I love that. It's so much simpler. I talk to
mm,
young men, especially in this country. I think they have no idea. Like, am I supposed to be nice, polite, strong, weak? Like,
mm,
I'm confused. Like, I'm not confused at all about who I am. And we're not getting into politics of it, but my point is having this dichotomy in the back of it, I was very it's a great place to be from. Like I used to work in Cook County Hospital.
mm.
Uh, Tough environment, very, very tough. It's a great place to be from. Not a great place to be at, great place to be from.
That's
Bye
really
bye.
interesting.
Bye bye now. Bye bye now.
Yeah, yeah. It's so interesting what you're saying about the clarity that it gave you. So I live in Mexico now, and I think, again, not to get into the politics of it, but when a life is so comfortable, people do get confused about what they're supposed to be doing and who they're supposed to be and what their path is supposed to be like. So that's
I
an
agree.
interesting take. I never would have guessed that that was your takeaway from it, but it makes sense, man.
I did with that, but keep in mind, I spent a long time developing who I want to be because I have
Yeah.
very, when I was 14 years old, I was like, I'm going to be this. I'm going to train
Hmm.
myself to do this.
And did you
We're in
become
Mexico.
that?
Yeah.
Yeah.
That's
Yeah.
why, I mean, I make no excuses how I behave because this is who I am.
Hmm.
And basically, I believe in giving people, my basic premise is this: I give people back what they give me with a little extra edit. Be it good, be it bad. If you
Yeah.
go way outside your region to make my life horrible, I think it's the least I can do is repay you with a little extra. Where in
It's very
Mexico do you
generous
live?
of you.
I'm a geek. What can I tell you? Where do you live? We have a home in Mexico in San Miguel.
Oh yeah. Oh, okay. That's a beautiful spot. We're in Tulum, so East Coast.
Not so bad. Not so
Not so
bad.
bad. No, not so
Nice
bad.
pyramid.
Yeah. Some good ruins around. Some nice. My wife is at the beach right now with her daughter. She goes all the time. It's definitely beautiful.
I've been. It's
Uh,
gorgeous.
so you decided to pursue this medical career, but you did not set out to treat trauma, correct? You became a pain medicine
No.
doctor, and you almost stumbled upon this using the stellate ganglion block to treat chronic pain, correct?
Well, let me give you a better way of saying it, if you don't mind.
Please, yeah, yeah, please.
First, I was born. So both of my parents were physicians. My father was a surgeon. My mother was an endocrinologist.
Hmm.
So then I started my surgical residency at Cook County Hospital. Pretty intense environment. One of the toughest training facilities in the country at that time. Anyway, so my mother took her life when I was an intern. So I switched from surgery to anesthesia. And within anesthesia, I really didn't like anesthesia, frankly. So I became a pain doctor. So it's injections for pain and stuff
Mhm,
like that. You have a degree.
mhm,
And then, so I had a patient came in with hot flashes and she said, I have hot flashes, blah, blah, blah. I took care of her neck pain. I did that. So I sent her my brother, who's an internist. And I said, I don't do hot flashes. You take care of hot flashes. That's not my problem.
mhm,
Anyway, so he tried, nothing worked. So he said, you do stellate ganglion block for CRPX, complex regional pain syndrome, which is sweating of the hand. She has a whole body sweating. Just stick a needle in her and see if it goes away. I was like, it doesn't work. He's like, how do you know? I said, nobody's done it. I said, try it. So I did it.
hmm,
I published on that. And then Chicago
mhm,
Tribune came by and they said, I know I was in trouble. The first line in Trib, which is the biggest paper in Chicago, was Bianca Kennedy, this beautiful breast cancer survivor, let Dr. Lipov plunge a 3-inch needle in her neck. And yes, it worked, but he does not know how his horse is garbage. Then I went to Northwestern when I went to medical school and they go, oh my God, this is not the kind of person we train. No. Then I went
mhm.
to Rush where I fellowship and they go, we did not train him like that. This is terrible. So they had no problem with the result. What they didn't like, I didn't know the mechanistics.
Yeah.
So I got quite annoyed with that, to put it mildly. So I read about 3,000 articles. One of them was a Finnish article where they did T2 clipping, which putting a tube in the chest, pushing the lung out of the way and clipping fight and flight nerves in the chest for
Okay.
hand sweats. PTSD went away. I was like,
Mm,
why would, and that's crazy. So then I did some research. Turns out stellate ganglion is a kind of nexus between the chest and the brain.
mhm,
So I called my brother. I said, send me a patient with PTSD, see what we can help him. So this guy was abused during a robbery. 2 months later, he was on his way to be admitted to psych ward. So I did the
mhm,
block, took everything away. He didn't have to be admitted. He did great. And then I published that in 2008. And here we're talking today.
mhm.
That's the real.
I I read some of the research, some of the literature around this. That must have felt crazy at the time because PTSD, PTSI was not very well understood back then. And here you are with this experimental treatment, the first person in the world doing this. How did that feel
Yeah.
for you just as the guy pioneering that?
Well, considering my background, which I think we've discussed,
Yeah,
when people give me suggestions, I only listen to a very few people in my life. My wife is number one, and everybody else is a far second. So when people tell me all type of stories, I'm wrong, I'm stupid, I'm dangerous, whatever, I go, "Thank you for sharing your input. I really appreciate it. Don't care. Like, don't care." I'll give you an example. I just finished my anesthesia residency, and I became an attending at a big institution, and then we had like a citywide meeting, 2,000 people, like all attendings, all trained, and there was a table of 6 experts. I was one of them. So I gave up. I gave the speech, and then um, one of the guys sitting next to me, he said, "You're wrong. That's inaccurate. What you're presenting is completely wrong." He asked people in the audience who agreed that I was wrong. Everybody picked their hand up. 1,000 people, like all trained. I got up and I said, "With all due respect, medicine is not a democracy. Either it's not. Anybody who has a question, ask me about my paper. I will give you the paper." So as I'm walking out, my chairman goes, "That's arrogant. I've seen arrogant. That's arrogant. However, I know when you say there's a paper, there's always a paper." You know how many people ask me for the paper? Nobody.
yeah, that sounds about
Everybody
right.
has an opinion. I don't care about their opinion. If I've seen it work, so the caveat to Chicago Tribune, right? They said I was full of shit, blah, blah, blah. And interviewed Northwestern. Northwestern got $4 million grant from NIH to study hot flashes. They was heralded as a great institution 7 years later about
Of course.
evaluating hot using Stellate. So, I mean, my point is how it felt for me is like I anticipate people give me grief. So when they don't, I mean, that's a marvelous opportunity. But usually people will give me grief because they have secondary agenda about everything. And when I see a patient getting better, I'm not really interested in people's input. What do I care? They're getting better.
Yep. I imagine it's been a frustrating experience for you trying to navigate the entrenched healthcare system and funding system. Perhaps not frustrating because you just don't give a shit what people think. But Western
Well,
medicine
it's not
doesn't love when
that-
there's not a mechanism that they can explain things or a neat bow that they can wrap on things like that. And you're just saying, well, I did this, my patient got better. Shouldn't we be celebrating that? Like, isn't that what matters?
well, there's three answers to that. So A, I am frustrated by not being able to help more people. True. The mechanism, I published a paper in 2009.
I want to talk to you about this, your unifying theory behind it, right?
Correct. And they have been functional MRI data from 2015 showing I was right about
Hmm.
stellate. So it's not a lack of understanding. Think of me as Model T and think of psychiatry as a horse and buggy. I'm a disruptor, right? So psychiatric model is each patient's an annuity. To me, I just want to treat the patient and move on to the next person. Think of a trauma surgeon as opposed to internist, right? So I think it's going to happen. I think this is a year, and I'll tell you why this is a year everything will change. But there is a lot of entrenched interests, financial interests. Follow the money. Who makes the money? Anyway, go ahead.
And no, I agree with you, man. This is what we're seeing with psychedelics. I think there's the adoption and embracing of ibogaine because there's the potential to make a lot of money from it. You don't see that with ayahuasca. You don't see that with psilocybin microdosing because there's no money in it. I, all right, I want to put a pin in your theory for just 1 second. Tell me about why 2026 is the year that this will be adopted, or the year that there will be a revolution in this.
Two reasons. Number
Mm-hmm.
one, the study that should have been done a long time ago
Mm-hmm.
should involve a objective brain scan before and after stellate. There's only one done by Dr. Alkire, 2015, very small.
Okay.
So an amazing foundation gave us money. Glenn and Linda Greenberg. They gave us enough money to be able to give funds to NYU to do the study. FMR before, stellate, FMR later. and it looks very promising. It should be out this year.
Amazing.
One, that's the most important study from my perspective. Number two, the military has done a study before, and three institutions. They did 110 people. It published in Journal of JAMA. That was published in 2020. The problem
Hmm.
is it was N of 110, so not a big number, and they didn't have any objective assessment tools. So it was dismissed. I mean, it's been 6 years and nothing. So now they've done a
Okay.
bigger study, 426 people, and it should be out this year. So I think if those two come out and show what I anticipate, people just go, especially FMR study. I think that's where I'm putting my um, focus on, because I think the problem is there's a whole thing about placebo. Real? Is it real? Is it not real? Can you do placebo? It's impossible to do placebo with stellate ganglion block. People go, "Oh, it's not possible
I
to do." Why? You didn't do placebo. Didn't do placebo. Well, we can't do a placebo because the eye drooping, it's red, and the pupil is small. You cannot do a placebo with
yeah.
psychedelics. How do you do a placebo with psychedelics? You can't.
I wanted to
You
ask you that
can't.
because I read one study where they had a sham procedure, and I was like, how do you do a sham stellate ganglion block? Maybe inject saline into them so they still have the needle,
Yeah.
but you kind of
Well,
know
you
if
do
it
it.
happened or not.
Well, exactly. So, well, for example, I was talking to a big institution. We were talking about design, study design. And they're like, well, how about this? How about if you put a patch in the eye? Okay, you put a patch in the
Shut
eye,
up.
but your nose is still going to be full. Your arm is going to be hot. Your face is going to be dry.
That's like
What's
saying, hey,
stupid?
let's have someone look through a kaleidoscope to simulate doing mushrooms. Like, okay, what are we talking
Yeah,
about
my
here?
point is it's impossible. The whole concept of placebo is not bad if you have two pills that look the same.
The whole
Yes.
placebo RCT thing, it's designed to prove pharmaceuticals. It doesn't work for
Yeah.
this kind of thing. And people just
No,
assume that's the gold standard and they reject any other evidence. It's very frustrating.
well, that's changing. That will change. And I think that will change the next 15 years because the brain scans are coming our way, whether we like it or not. So you'll
Yeah,
be able to see somebody who's meditating, somebody who is getting psilocybin. You'll be able to see the difference in the brain. You don't need a placebo. You don't need the patient tell you nothing. You can just scan it.
yeah. Talk to me about that. So you feel like that is an effective proxy, if you will, to see has this person healed or not? Like, is the brain scan very tightly correlated to the outcome measures and the subjective experience of the patient? I'm just not familiar with that kind of research.
Well, let's walk toward it carefully.
Sure.
The research I know a lot about is research about PTSD. Post-traumatic stress
Okay.
disorder. Dr. Librazan published a paper in 1984, functional MRI showing that amygdala is overactivated. So
Hmm.
amygdala is, fight and flight, anxiety, anger, all of that. That sits in one area. So when you show people nasty faces, that's part of the brain that lights up. Just is, right? So if you can deactivate the amygdala, whichever method you use, psychotropics,
Hmm.
whatever, if it's
Hmm.
deactivated, it's associated with reduced symptomatology. So that makes perfect sense. When it comes to psychedelics, I think it's a little more nuanced. I'm not an expert. That PTSD I know a lot about. I've read a book that said they can actually tell when somebody's meditating, somebody who's getting ethereal plane entry.
Hmm.
I'm not an expert, but because those are different networks. There are people who are experts who do that, but there is a passive network that controls your ego. Apparently,
Hmm.
that's what's really hurting you. So you can see that passive network function change with psychedelics. That is so cool to me. That's amazing.
You're referring to the default mode network, right?
Yes. That's what I meant. Yeah.
Is that touched by anything with the stellate ganglion block? Has that been shown to be affected at all? Have we done the research to see
I'll
that?
give you
Maybe not.
maybe. I'll give you a maybe. And let
Okay.
me give you a different answer. Uh, that's expensive research, right? I mean, we're talking about
Yeah.
very expensive. So if it's going to come out of anything, it's going to come out of NYU study because they have a superb scanners, world class neuroscientists. Once it comes out, I'm going to go there and like take a really big magnifying glass and look at anything and everything possible. There's probably going to
Definitely.
be 100 papers coming up, I hope. But let me just tell you my view of the word. So I'll tell you physical evidence and what happens in reality, right?
Right.
So we had a patient that had to shoot a child line of duty in Iraq. He he was laid an explosive. The child was a piece of a
Yep.
child hit the soldier, came home,
Yep.
horrible.
Yep.
Tried to kill his wife, whatever. Anyway, we do the block. 10 minutes after the block, he says, "I'm now calm. I remember what happened, but the anger and the blood is gone.
Right.
Now it's
Right.
black and white." So
Yep.
why does that happen? Amygdala remembers everything in color. It's emotional memory, while hippocampus remembers facts. So hippocampus started to work, amygdala got deactivated. So there was a study done in Philadelphia where we had people that had hippocampal infarct. So they had short-term memory loss. They couldn't
Mm.
remember. They meet the same person every time, knew every time to see them. So what they found, they would show happy movies and ask them 2 hours later, how do you feel? Happy. Why? No clue. Next day,
Mm.
they show them sad movies. How do you feel? Really sad. Why? No clue. Amygdala has a totally separate memory.
Right.
So flight nerves affects that. So the network we're discussing, basically a lot of times self-negative talk and all the stuff, right, that sits in that network. So if you can deactivate the amygdala, I think that negative talk is deactivated. So it's like you say, well, you're ugly. Your breasts aren't the right size, whatever. The amygdala goes, I don't care. I'm not really interested in that information. Thank you so much for the information. Don't care. Kind of like my perspective. Hippocampus goes, objectively, I have two breasts. I'm functioning female. I'm good. Go away.
Mm.
Don't give me any craziness. So in order to have the memory, in order to have the emotional punch, the amygdala has to be nuts. Yeah. It can make you feel miserable because it tells amygdala to feel miserable. If I can deactivate the amygdala, life's good.
Yeah. It it makes sense. I think the only reason I'm a little bit wary of everything hinging on these imaging studies is it, you know this
Mhm.
from your pain science background, from my physical therapy background. I can take an MRI of 1,000 people. 70% of them have symptoms on the MRI, but they might be asymptomatic in terms of their back pain and things like that. So the imaging doesn't
Oh,
always
no,
tell the
no, no.
story. Go,
No, no, no. About that. No, no,
okay.
no. I think I know what you're
Tell me.
getting there.
Tell me.
So if you study that big study, they
Hmm.
scan people's backs and they look at them, how many of them have symptoms? 50% of people with bad looking backs have symptoms. The other ones don't. They have no pain, right?
Right.
That's what you mean by imaging, I assume.
Yes.
However, if you do the brain scan showing
Mm,
pain, also pain with a brain scan, total different with a back
okay.
pain. Back,
Okay.
it doesn't matter what the back looks
That makes
like, right?
sense.
It's what's
Well, yeah,
going on
it's
inside the
mediated
brain.
by their processing of it. Yeah.
You can see pain in the brain. Like I'll give you one example. So there was a patient that had horrible pelvic tumor, an incurable, intractable pain. No question, she was going to die, but they could not
Hmm.
control it doing anything. No drugs, nothing, nothing. Nothing. They went to a neurosurgeon. He did a singulectomy. He cut out the cingula, and he said, "Yeah, I have pain. I don't care.
Hmm.
It's a perception. It's not the pain. Pain is a
Right.
signal.
Right.
Misery of pain lives in a different part of the brain. It's like
Okay. I
somebody
guess
has
I was,
CRPS. Are you
of course.
right?
Yeah. Yeah.
CRPS.
Yep.
So a buddy of mine next to me here in Northwestern, he has a whole thing. Light touch and CRPS hurts. Complex regional pain syndrome. It feels like somebody's pouring
Hmm.
acid for those of you viewers who
Yep.
haven't heard of it. Very painful. So he had a mechanical way of touching it lightly, and you could see the insula lights up like a candle in the brain in CRPS. That's a
Okay.
severe pain condition. Severe.
Right. Okay. I'm glad to be wrong that I was falsely equating the structural scans of somebody's back with the brain scans.
Oh, I
It
mean,
makes sense what you're saying.
yeah, because I mean that's the whole thing. It's like looking at the back does not tell they're hurting. Like when people
Exactly.
come in, they go, Well, you look at my scan. I said, I don't care what the scan shows. What's bothering you? The back
Exactly.
looks bad, neck looks okay, but my neck hurts. It's like, how about if I treat your neck? So the whole thing, when I train people, we're not treating the scan, we're treating the patient.
The
It's
person.
called
Yeah.
listening to the patient. New concept, right?
Yeah, it's crazy. That's half the reason I became a physical therapist, was to actually have a relationship with people and care about what they were saying to me and not interrupt them after 7 seconds like most orthopedists do. Um, can we talk about your theory of the mechanism by which this helps people? I was doing some reading about it, and I read some detractions from it and some support of it. So could you explain to us how you think the stellate ganglion block results in helping people heal? How does that actually work?
Sure. Happy to do it. Before that, you know what I think about my detractors, right?
I do.
So
I
when
love it.
people argue with me, just give me the data. Give me the data it's
Yeah.
based on.
Yeah.
Just saying that I'm not interested. It's like, well, that's really not an argument. That's a contradiction. Anyway,
Yeah. Yeah.
so if you don't, I will give you a lot of detail,
Please.
maybe a little too much detail for some viewers, but let me give you detail. And if you want to read about it, in 2009, my paper came out. There are some new papers been out, especially from China. So we'll talk about it in a second. But so here's the basic thing that we do know that happens. Trauma happens. The first thing that happens is norepinephrine secreted in the brain. No debate, no discussion. So if that state persists, people have PTSD. So if you take a soldier, let's say, that has PTSD, and you take CSF with the fluid around the brain, you analyze that norepinephrine level, you'll be twice as high compared to somebody who does not have PTSD. That's just a
Mm,
fact. There's no debate. So norepinephrine is a big part. That's a main transmitter in the brain of PTSD. Fact one, no debate. Fact two, when trauma is severe enough, NGF is produced in the brain, nerve growth factor. That's transported from the brain to the stellate ganglion. That's been shown in the rat model when they tag the molecules. No
mm,
question, no debate. Fact three, if you take NGF substance, inject inside the brain of a rat, the biggest growth of nerves is sympathetic nerves. That's called sprouting. No debate, no discussion, happens.
mm,
Fact four, when you do an injection of retrorabies virus, which is a way to follow things around the nerves,
mm,
labeled virus, if you inject this ganglion and then looks inside the brain, there is a direct connection, second and third neuron connection from the neck to the brain. No question, no debate, right? In order to maintain this extra nerve growth we were talking about, it's called sprouting, you need to have certain amount of NGF in the ganglion. No question, no debate, right? Done. The key point is once you put local anesthetic onto the NGF, it deactivates it. Why? God built it that way. If you listen reference, read my paper. As NGF level drops, the NGF supported sprouting, which is extra nerve growth, falls away. That's called pruning. So a block that lasts 8 hours can give you nerve change that can last forever, or longest outlier is 17 years, or so on. So there is actually neurological reconstitution in the brain that happens. Isn't that interesting?
It was very interesting for
That's
me
great.
reading about this, because we often just equate nerve growth as a positive thing, and like increased neuroplasticity, increased
Oh,
neuronal activity. And as I was reading this, the nerve growth that occurs is primarily with the sympathetic neurons that are driving the fight or flight response, right?
correct. So, but look at something else.
Hmm.
Ketamine is sympathomimetic, meaning it increases sympathetic tone. Some
Right.
people get completely wigged out. Why? Sympathetics grow, right? It promotes sympathetic growth. So I came up with a method. I call it SOF, Special Operator Force Method. So it's basically why you do ketamine and sell it together. So the extra nerve growth that happens from ketamine is good, normal brain, but sympathetics is not good, but I can take it away with stellate. That's why you
Hmm.
have advantage of both.
So you're saying the ketamine, it has pros and cons, so to speak, but the stellate ganglion block mitigates
Correct.
the other sympathetic tone that could come from it.
Yes, it's like
Interesting.
buying the fertilizer and a weed killer. You only get the nice flowers. You don't want the weeds.
So
Pathetic is the weed. You want to get rid of the weeds.
one of the other things that confused me, or that was new information for me reading about this, was the role that norepinephrine played in that sympathetic response. Because there are drugs that are SNRIs, like serotonin norepinephrine reuptake inhibitors, to treat these things. So I thought, okay, so we want more norepinephrine, but this model says no, it's the complete opposite of that. How do those drugs help if
Whoa,
this is the
whoa,
case?
whoa, whoa,
There's a
whoa,
lot of
let's
other
pull
things at
back.
play,
Let's
I'm
pull back.
sure. Okay. Slow me
No,
down,
no, no,
Dr.
it's not that
Lipov.
no, no, I mean, SNRI increases norepinephrine levels. True, but that's not used for PTSD. That's used for depression.
Hmm,
The thing that's used for, I mean, we can debate it, but I mean, so the biggest drug that's used currently for uh, sleep disorder with PTSD, you know what it is? Prazosin. Prazosin is alpha 1 blocking agent. It blocks effect norepinephrine. Drug
okay.
number 2, or the most common drug used globally for PTSD, is clonidine. Clonidine deactivates sympathetic nervous system.
Hmm.
Increasing norepinephrine typically is not a great idea for PTSD. For a so there is anxious depression and there is regular depression. For regular depression, norepinephrine increase could be really a good thing.
Hmm,
So I mean that's how I see it. But
okay.
sympathetic system activation for PTSD is a very bad idea.
I agree. I'm not saying the SNRIs were a good approach, but I've met a handful of folks who have been put on that for their PTSD. Not
Yeah,
successfully,
yeah,
I'll add, but just
yeah.
I was trying to
And
understand how
then,
that
the
worked.
great, let me tell you how it's used. SNRI gets put on, the people get more feisty. They go, oh, okay, we need to give you a major tranquilizer. It's called atypical antipsychotic. That's like completely shuts, it's like less chemical lobotomy. Then you're like, so yeah,
This one
I don't know.
person in
I can't
question was on
defend that you,
26 different pills a day at one point. So yeah, there you go.
yeah, it's really, you don't know what's doing what to who, right? I mean, it's like,
Yeah,
what's happening now? They have to give Preventin because they have side effects from atypical
yeah.
antipsychotics. What are we doing?
All right. So going back to your theory, the what is the actual anesthetic that's used? Is it lidocaine or novocaine? What do you use for the blocks?
Bupivacaine.
Bupivacaine. I'll write
Bupivacaine is
that one down.
long-acting bupivacaine. It's what's
So
used. Did you have epidural for pregnancy?
no, she gave birth in our house unmedicated, like a badass.
Okay.
But I'm familiar with what you're saying. Yeah,
Wow.
yeah.
But that's what's used. So bupivacaine's been around. Been FDA approved since 1972. It's
Okay,
used in pregnant women, so you know it's safe. It's a great drug
absolutely.
if you know where to put it. That's key.
Uh, yes. So you're saying that the bupivacaine, it just naturally deactivates the nerve growth factor, and that is the
It
mechanism by
reduces.
which this whole cascade takes place. That's
That's
fascinating.
correct. And if you look at the picture, you can look at the references why it is. It just got built that way. I don't know why.
But that's interesting for me. Obviously, we have the pain background. People get nerve blocks all the time, or an injection for their sciatica or something like
Yeah.
that. I thought that it was a similar
Yeah.
kind of mechanism of just down regulating the neuronal activation and the pain signals that it's creating and things like that. But you're saying no, it's really all driven by this nerve growth factor.
Well, let me give you an answer. Maybe. So let me tell you what I mean by that. For example, one of
Yeah,
my blocks that I like doing is it's called celiac plexus block. You have to go through the aorta, in front of the aorta at L1 level. It's
that
for
sounds
abdominal
sketchy.
pain. Yeah, I mean, if somebody has pancreatic cancer pain, let me tell you, it's not sketchy. It's life saving. I mean, it's not done for fun. How are you? Let's do celiac plexus block. It doesn't work like that. Anyway, so And I know I'm kind of nonchalant about it, but it is what it is. But I've seen 10 cc's of bupivacaine, 0.5% less for 3 months after one block. Why does
Hmm.
that happen?
Hmm.
There's, there's multiple mechanisms why the pain goes away. It probably has something to do with NGF. It probably has something to do with top-down regulation from the brain. I don't know. Nobody knows this. But we do know for a fact. So if I take NGF, inject inside the brain of the rat, sympathetic fibers will sprout. No question, no debate, no discussion. We do know NGF concentration goes down if you put local anesthetic onto the ganglion. That's
Hmm.
just a fact.
Hmm.
So then the question is, if you think about it, the question you're asking, and I'm not saying you're aggressively asking me this, but let's say I'm wrong about the theory. Let's say, okay, but it still works. So the
Exactly.
latest thinking about this,
Exactly.
right? But the latest and the greatest. So I'm writing a book right now. There was a book written. It's called Stellate Ganglion Block. It was written in 1954, out of print since 1972 by James Moore. Amazing book. So the publisher of the book gave me permission to use everything in that book. So I'm writing a new book. It's called Stellate Ganglion Block: A Century of Progress.
Hmm.
So the mechanisms are much more complex than I just described to you. Let me tell you what's important. Stellate ganglion has been shown by tracing studies to be connected to the thymus and the bone marrow. Thymus produces T cells, bone marrow produces B cells, right?
Hmm.
Inflammation that when people get PTSD, the interleukin 6 increases. So inflammation is a big part. If you put inflammation into the venous system, gets inside the brain, it leads to depression.
Hmm.
A big part of the mechanism, besides norepinephrine, it suppresses inflammatory response of mental conditions. There is a lot of evidence to that effect. Fact number 3, local anesthetic changes DNA of the ganglion. So you can actually impact a DNA
Really?
change of the ganglion. Yes, I can send chapters of all this. I won't
Yeah.
bore you with all the nitty gritty of it, but there is definitely points to that. So then the question is, okay, that's interesting, but who cares? What does it mean? Anything? Well, let me give you an exact example. Let's say somebody gets bebop in the head, TBI, right? The thing that happens, so after you get hit in the head, the response of the body is to produce immune response, and that's what actually kills the brain. That's what hurts the brain. If you do a stellate for TBI, it reduces the TBI.
Hmm.
That is,
I, I hope I didn't come across as aggressive.
oh,
I'm excited about this. As I was reading all this research earlier this morning, I was learning a lot that I wouldn't have
can I finish that?
otherwise imagined. So that's why I'm just trying to wrap my head around things.
No, I get it.
Do you,
No, I get it.
do you
I
need to
mean,
go take care of something in the house?
no, we're done. We're done.
Okay.
But
Okay.
the point is, the mechanism is very complicated. What
Yeah.
I'm hoping will happen again after this year, people will take it seriously. And then the neuroscientists can get to work and they'll go, well, yeah, he had a good idea, but he was completely wrong. Fine. I was just trying to get everything I present to you is based on publication and facts and all of that. So there you
Absolutely. All right. We probably did just alienate and bore my average listener who doesn't care so much about the neuroscience, but thank you for indulging me, Dr. Lipov, in all of that.
I think it's good for people to understand. But actually, it's interesting. I think what I find, even if you may not have a medical neuroscientific background, it's kind of fun to have this kind of banter. And at least somebody, if understands it, I think it makes you feel better, I hope. Because
I hope so too.
right, in the modern day, if people don't understand why it works, they want nothing to do with it. They think it's garbage. They just go,
Yeah, and I think people are coming around to want more ownership of their own health and want to understand the process. I think trust in the medical system is kind of at an all-time low right now. So people need to be able to understand these things and ask the right questions and seek the right treatments from their doctor and not just trust that the VA is just going to magically do what's best for them.
especially psychiatric professionals are not highly trusted or respected. Because
No.
obviously, it doesn't matter why you do this, right? What is the outcomes? So I'll give you one statistic that everybody can understand easily. This is the highest suicide rate ever since World War II beginning, since 1941.
Mm,
So any way you cut it, whatever we're doing, all the money we're spending, all the drugs we're using, all the psychotherapeutics, marvelous, not very effective. And the worst part to me, the suicide rate in preteens, we're talking about 9 to 12 years old. It's probably the highest ever. And it's the number 8 cause of death currently in the United States for preteens. That should be frightening to most people. I treat children with Stellate Ganglion Block, by the way.
really?
Very proud of that. It works very well. It changes their lives, changes families' life. But the point is, people go, it's like they still debate. Oh, children cannot have PTSD. Hell yes.
Of course they can.
Same.
That's when it starts,
Yeah, let me give you another thought. So we know trauma affects the immune system, no question.
for sure.
What prevents cancer? Everybody develops cancer, but the scavenger system picks up all the tumors and eat them up, right? So if the scavenger system is decreased, the tumor rate is higher. So I think we can reduce cancer rates if we can reduce overactivation of sympathetics.
Yeah, it's really interesting what you're saying, how the stellate ganglion block affects that. We know a lot now about the health or lack thereof of your gut microbiome and how that drives inflammatory responses,
Yep.
which drive cancer, and how trauma is linked to that, and how the gut is linked to your mental health. So having another angle to approach this with this SGB, which is so
You
safe
got it.
and nailed it, safe, well tolerated, accessible. Like, why are we not doing more of that? Can I ask you this? Who is it not for? Is it contraindicated for anybody? Is there anyone who shouldn't be pursuing this?
Well, let's start first of all, who's going to do it? So
Okay,
if you're going to have somebody do it, there is a wide variety of people who are doing it, unfortunately. So the
of
only people,
practitioners delivering the block, you mean?
correct.
Okay,
Correct. So the people who should be doing it are pain doctors who are trained in ultrasound, ideally, who do pain procedures all day long, and they're trained to do
right,
them. It's that simple. I saw
right.
a chiropractic physician
Ugh,
doing a
that's
procedure
concerning.
blind without any guidance on the video. I report them to the state.
That's terrifying. Do you
Yeah,
do it under fluoroscopy? Is that how you typically do it?
no. The way I
Okay,
started it, I did the blind, which is basically you palpate and stick a needle and hope. Then I did 30 years of fluoro, and then I switched to ultrasound. The way to do it is ultrasound.
ultrasound. Okay, okay,
So if a physician says, I'm going to do it for you, make sure they use ultrasound, they're trained, and they also have all the emergency measures. That means
mm,
resuscitation cards, interlipids, everything. If they're not board certified in pain, run the other way quickly. Do not let them do it.
yeah. And I mean, it's like you said, somebody who knows how to get the needle where it's supposed to be and avoid poking all the things that shouldn't be poked with sharp things. That's
Right.
why I said it sounded sketchy when you were like, yeah, we'll just pass this needle right next to your aorta. I'm like, what the
No,
hell?
no, I was trying to go next to aorta. I went through the aorta. Celiac plexus block, that's how you do it. You go through the aorta. Bang.
That's crazy.
You have to be an outsider. But that's how it is. I mean, that's the block. It's not done for fun. But my point is, I know. Ha ha ha. So stellate, not only do you want to have practitioners who are trained to do it, also they should be trained to resuscitate you if something goes wrong. It's extremely
Right.
rare, but the one time you need to make sure you have all the equipment, all the training, you have the right staff, you have everything, right? Anyway, switching gears to who is a candidate, who's not, right?
Mm,
So the not, so you raise sciencey talk. You're talking about what is the exclusion criteria for stellate? The exclusion criteria are the following: not having a neck.
cool.
Sounds
Check.
funny, but it's not that funny. Somebody is 500 pounds. They come in and they have shoulder earrings.
Mm,
No, not safe.
okay.
Cannot do it. So obesity, no. Bleeding disorder, no.
Sure.
Somebody who's on blood thinners, no. Bad heart, bad lung, all bad. No, absolutely not. Do not do that. So physiologically, they're not a candidate.
Okay.
We have nurse practitioners who assess people. So certain type of manic depressant people, like type
Mm,
1, it could destabilize them. That's not a good idea.
mm,
We try not to treat schizophrenia. We treat schizophrenia a couple times successfully, but it's dicey, right? Um, so that's pretty much the rule out. So physical, if the people are unhealthy for epidural is the same requirement. Somebody has a
right.
heart, bad lung, bleeding disorder. Nobody's doing an epidural on that person, right? So, so that there you go. There's your exclusion criteria.
And what
Suicidal,
have you,
suicidal, we don't do that.
if they're actively suicidal?
Yeah,
Yeah.
that has to be in the hospital. That we're not doing that.
Yeah. Um, and it seems like there's, I mean, as with anything, there's going to be a percentage of people who don't respond.
Right.
Are there any similarities, any kinds of patterns that you see there? Anything predictive of whether or not someone would not respond to this?
It's a great question. Don't know. I've tried to figure that out. Um, they could be one of the things I'm interested in. One of my buddies is developing an assay for dopamine receptors.
Hmm.
So it could be infections which are causing PTSD like symptoms. So there could be other workup. Also, anemia, for example, can cause it. Head injuries, TBI. So the point is, our failure rate is probably 15-20%, give or take.
Hmm.
Anybody who says my treatment works 100% of the time, you want to run from there.
Yeah, they're bullshitting you.
Yeah,
Yeah.
it's possible.
Yeah. I saw an analogy that you used in, I think it was in that white paper, sort of like the stellate ganglion block being like the primer, and then the rest of the psychotherapy being like the paint that gets applied on top. And I liked that.
Not a
And
good
that,
analogy, but that makes sense.
okay. Yeah, I forget where I read it, but that made sense to me. Again, with the physical therapy background, it's like, hey, any intervention that's going to create a sort of pain-free window where then I can get the person exercising and taking care of all these other things, it's going to break that cycle of pain and allow them to work on themselves. This strikes me as something similar where it can be hard reset is such an
So if
oversimplification, but
I
it
may,
can,
let me give you a real story, which will
please.
clarify. The other part, you're not doing physical therapy, someone has a broken back, right? Fix the back first. Hello? Anyway, so we had a patient in our Australia office where this guy was picking up dead bodies, which is his job as a policeman, from tunnels. And then, so he was depressed, he was suicidal, he was all of that, 5 years. His therapist was also his psychiatrist. So he gave every drug known to mankind, tried every
Mm,
approach, blah. He has a stellate ganglion block. 2 weeks later, he was a completely different man. He reduced his medication, he could sleep, because now he is available to have psychotherapy to polish
right,
everything out. But the
right.
main reset has already been done. So that's exactly right.
Yeah, and now maybe I'm misquoting you, but talking about like the metacognition that's required in therapy. So it's like, how is somebody who is actively not in a good state, how is that person supposed to work on themselves? It's like Alan Watts talked about this paradox a lot. How am I supposed to improve if I'm the one who needs improving? So the SGB kind of gives you this window to actually access feeling better and continue to work on that. And I feel like that's very similar to what psychedelics can offer somebody in a good, like the best case is a glimpse into what my life might look like without PTSD or without the suicidal ideation, or where I actually feel unconditional love. And now how can I get more of that on a daily basis? How can I build that as part of my life?
Let me, can I give you, that's really not my quote. I don't use those terms, but let me
Okay.
give you something to think
I
about.
forget where I read this then.
It
Please.
ain't me. It ain't me. I mean, no meta states. No, that's I don't speak like that.
Okay.
Anyway, so here's a couple of things to think about. One, nobody killed themselves if they have hope.
For
I,
sure.
psychedelics give you a glimpse at a normal life. One, but that's like fluffy for me. It's not as specific. However, we do know that psilocybin and ibogaine, those two, create new nerve growth. No question. They activate the PFC, prefrontal cortex. PFC suppresses the amygdala. Also, psilocybin also activates hippocampus. Guess what psilocybin does? Suppresses the amygdala. One of the treatments for PTSD is Tetris video game. Tetris video game activates hippocampus. If you go to my
Hmm.
website and download my presentation APA about that. The point is, if you can get the brain structure stronger, they can suppress amygdala, you're going to feel a lot better.
Do you feel like the amygdala has a positive purpose in modern humans anymore? I get evolutionarily why it was effective, but everything we're talking about is how can I downregulate the amygdala and get that out of the equation?
No, 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 if I may. So here's the thing.
Please. Yeah.
If I cut the amygdala out from a rat, let's say, you cannot give him PTSD. Like we know amygdala is a big part of PTSD. However, if you have no amygdala, you have no emotion.
At all?
Yeah, you have no emotion. So if your
Hmm.
limbic system isn't happy,
Interesting.
nobody's happy. And amygdala is a big part of limbic system, whether you like it or not. So the point is, if amygdala is functioning normally, like I'll give you a specific example. So we took care of a guy who was a vet from Vietnam. 50 years, 50, of PTSD, multiple admissions for addiction, lost his family, blah, blah, blah. We do the block. He started crying for an hour. I went there. I was like, good Lord, I broke this guy. I said, why are you crying? He said, I have not felt an emotion for 50 years. If the amygdala is working correctly with the limbic system, which is very complicated, I think you need that. And, the joy of human experience is emotion. I wouldn't want to be a robot like a
Right.
Spock. I don't want to be a Spock. I want to have emotional life.
No, that makes sense. I mean, you don't appreciate the good times without the hard times for one thing. And what we often see is somebody who's on SSRIs, they've been made to be numb. And that's great if you're suicidal and this gets you to still be here.
Yeah.
But
Yeah.
if you want to feel better, you have to be able to feel, period. So it will involve accessing some of those negative emotions to have the positive ones too.
But the other part is, as you said, let's say poof, you can cut the amygdala out, right? But think about it. When you're walking down the street, I would say you don't have a cyber tooth tiger attacking you probably. But a lot of things can happen to you. Also, if you're driving in a car and things could happen, you're like, I need so amygdala not only responds to stress, it also predicts. It's a predictor. So when I had just, I mean, I'm not necessarily giving anything away. So I'm driving and I see out of the corner of my eye, this guy started to make a turn. So in my mind's eye, amygdala already kicked. He said, whoa, 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 whoa. Turn on the sympathetic system, try to avoid being hit because the guy's already coming around. He did come around and he did hit my car, but I had control of it. My
Mhm.
point is you need the predictability of you. Also, if you see people riding toward you with knives, you probably want to get going.
Yeah.
And it's not
It's
only cyber teeth. We do not live an homogenized life. You have to survive walking down the street. Like right next to me, there was an attack on a lovely couple, 50 boys and girls. I attacked this beautiful couple just because they were white. So I'm sorry. I think amygdala has not done their job yet.
yeah, there's
Still here.
I I often talk about this. There's a difference between adequate situational awareness and
Yes.
hypervigilance. Like we don't want the hypervigilance, but you should be situationally aware of the risks
Could
around
be
you.
scanning.
Yeah.
And you need that. See, modern life doesn't mean it's homogenized. And you could be, God knows what could happen to you, right? That could be all type of bad things can happen.
Hmm.
So exactly. For example, a lot of special forces have received this procedure. And what they find, especially snipers, from being frenetic, they become focused.
Mm.
You want to be focused. Like when I was in another car accident, there was like 26 cars mesh up. I stayed focused and I hit a car in front of me intentionally, but I didn't get off. The point is, I was focused, and we were the only car that drove away
Wow.
because I never lost control of it.
Right. Carry the medical gear. You're just confirming that for me.
Exactly. It's like, oh, now that next time I see you have a backpack, you know, paddle, you're ready to go.
Hey, forgive me for how basic this question is. Maybe I could Google it. Why do you only inject on the right side? Or like, why is that the standard? And then sometimes you do both if it's not responding. Why just the right side?
Right side is dominant. So if you look at sympathetic system, it's dominant. And that's the only thing I
Okay.
knew, frankly. So left side by itself doesn't seem to work. Right side by itself does work,
Okay.
but a lot of times I will do both sides. But
Okay.
if you look
Makes
at the
sense.
FMR data, sympathetic system is dominant on right sided. No question.
Hmm.
So if you have one, pick the right. If you can do everything you need, then it's both.
Okay. Interesting. I want to talk to you about this is perhaps the elephant in the room, actually, because my podcast is called the Plant Medicine for PTSD podcast. And I know that you are an advocate of changing this to PTSI. And
I hate the
I,
term.
I didn't think too hard about it and choose one over the other. Just people recognize PTSD a little bit more, I think. And I was going for does what it says on the box kind of a title. Can you talk to me a little bit about the idea behind that? My understanding is that we manage a disorder, but you can just treat and heal from an injury. So reframing it as an injury means we're reframing it as there's a solution to this, not just managing it forever. Is that right?
Yeah. Well, before you feel so bad, you know, the name of our non for profit is Erase PTSD Now. So there you go. Because people know the term. So we have to use it.
Exactly. Yeah,
So
exactly.
the reason, so if you think about injury is what happens to you, disorder is what's wrong with you,
Mm,
right? So it's stigmatizing. I did the study in 2023 and it shows that PTSD term is stigmatizing. We changed the name to post traumatic stress injury. People will get more hope. They will get more treatments and they will not beat themselves up, right? So if you think about it, if you have a broken leg disorder, let's compare and contrast that. So you have a broken leg disorder. That means you have something's going on with your leg. You don't know what it is. We don't know how long it's going to be to cure it. We don't know what to do. Is it real? Are you pretending? Right? As opposed to you take an x-ray, the leg is broken, there's no debate, there's no discussion, there's no stigma. Fix my leg, doc, go. So the same when people talk about an invisible wound, one of my favorite terms, it's
mhm.
invisible if you have the wrong scanner. If you have an
Right.
MR, PET scan, MEG scan, you can actually see it. So if you have a broken leg but you have no X-ray, how do you know there is a real broken leg? Unless the bone
Mm,
is out. You don't.
mm.
Same thing. So the point
Makes
is,
sense.
look at it biologically, you should have biological treatments for this, as opposed to it's a weakness of soul and it's this amorphous blah 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 blah. I don't know what that is. All I know is sympathetic system has something to do with it, and people actually know that, but they don't know it. So if you jump in front of the bus, you almost got hit by a bus. You come back, hopefully you survived. What happens? You're hyperventilating, right? You're looking around. You're hypervigilant. That's norepinephrine. That's a normal response.
Do you do you only believe that there is this biological component? Do you believe that there's any sort of spiritual, psychological, emotional, whatever you want to call it, component to it? Or because I understand I can measure the biological component, I can treat the biological component, I'll focus on that. Do
Right.
you still believe that there are other elements, or do you feel like that's purely what this is?
Well, let me. I'll give my beliefs in a second. I will
Sure.
preface: we do not. When I when I talk about this, I'd like to be grounded in science because so many people have attacked me over the years. Right. So I'll preface that. I will tell you. So the brain has a number of functions. Right. It's obviously an organ. Like Egyptians thought it was just a way to get rid of heat in the body. It didn't have any other function. All the emotion came from the heart.
Hmm.
Yeah, maybe they were wrong. Maybe they're right. I don't know. Anyway, since I had an out of body experience, I believe there is something exteriorly outside of us. I do know if somebody goes inside the brain, cuts out half of it, you your ability to treat, to connect to ethereal plane is going to be highly subfunctional. I'm a great believer in there is a lot of things we don't know nothing about. I do know that when my brother sometimes calls me, I know he's calling me. Where's that from? And it's like, what's a premonition? What is that?
Yeah.
Well, now you don't understand. I mean, those things exist. And I think we are connected on a total different plane and level. We will be able to measure it down the road. I
Yeah.
mean, it freaked me out. Like, for example, I mean, you may not be thinking about it. Why, in God's name, if a light is observed, it's a particle, and if it's not observed, it's a wave? Why would that be? I have no idea. I don't understand that. I mean, why does that happen?
I love you, Dr. Lipov. This is fantastic.
Subtle.
I, I'm relieved to hear you saying this. It would have been so boring if you were just like, "Oh, this is just purely a biological process
No,
that we can
I don't think
intervene on
so.
in this
No, no,
way."
no. The quantum mechanics, I mean, the whole concept, you can go faster than light and you can actually calculate all that out. I mean, I'm not smart enough. I tried to take quantum mechanics. It was outside my realm of understanding because you need like really good math. But there's something I've experienced stuff like, I mean, how do you explain my out of body experience? And so many other people have explained. It's not like, and you can go, well, it's endorphin secretion. It's this, it's this, it's this. It just, the point, I'm not arrogant enough to know the science knows everything. I think we are just in the process of really understanding what really is going on.
Yeah.
I think, hopefully I will get to see some of it, but a lot of the biological fields and all those things, I think the future of treatment is physical in a sense that there'll be beams, there'll be fields that induces currents. I have no idea. And, you know, the big part of the brain, it's such an amazing machine that does so many things, and it can be modified by LSD, it can be do this, it can do that. And a lot of computer stuff is secondary to use of LSD and psilocybin, and it gave people a lot of insight. So, you
Hmm.
know, you can deny it, but it's reality, right?
Yeah.
Because you're stuck in your reality. The question is, why would they do it? Because if you think about it, sometimes when you take LSD or other things, people can smell blue. It's a totally different way of thinking, right? I mean, if it doesn't break your head, it expands you. I mean, our brains are really interesting. And the last analogy I want to give you is like, think about a brain like a computer. You have the hardware and you have the software, right? You're not going to seals, we're not going that far away. But if somebody has a broken chip in a computer, it's not going to work so good. You can have all the patches you want, they'll do nothing. Fix the chip. That's what Stellate Ganglion Block does. That's
Mhm.
what psychedelics do. It fixes the chip, and then you can do the process. This is how I see it.
Yeah, I agree with you completely. And as we were saying before we hit record, we've worked with a number of folks who've gotten this procedure and then went through our microdosing program to
Yeah.
support changing all of their habits and behaviors afterwards.
It makes
I
tremendous sense.
I use the analogy of a sick goldfish in a dirty tank. You can take that goldfish out and give it medicine, and now you've treated the goldfish. But if you put it back into its dirty tank, it's going to get sick again. So what are we going to do to clean up your fish tank?
I
And
think
we've seen a lot of success with that.
no, it makes sense. So you're talking about psychotherapy, then I assume. Yes.
No, so habit
Not
change,
all that.
shadow work. I wouldn't call it
Yeah.
psychotherapy because I'm not a licensed psychotherapist.
No, but it is
But
like it's a form of counseling, intervention, whatever. I don't
yes,
psychotherapy either.
we'll use the term coaching for legal purposes. But
Ah,
yes,
fair enough.
yeah.
I'm not trying to get you in any kind of trouble. My point though is when you do that, even if you have a pet, right? Dogs will help you. Just washing a horse is therapeutic.
Hmm.
All those things get you out of the usual bullshit that you're going through.
Exactly. Um, Dr. Leafo, perhaps the last thing I want to ask you about your upcoming book, which I think will be published this month or released this month, right? It's called The God
February
Shot.
15th. Yes, sir.
Perfect timing. Um, Talk to me about that title. Because I love it. Um,
Well, first of all, I'm not creative enough to come up with that. So what happens?
I
I
know.
was taken care of. Thank you. I appreciate that.
No, just I read that someone else.
I'm just kidding. I'm just kidding, buddy. Uh,
That came out wrong.
I couldn't resist. No, what happened was I was reading a Marine, and he said one of my buddies had a
Yeah.
Stellate Ganglion Block, and he calls it the God shot because it changed his life. So I want to have the God shot because the only entity that can actually change life is God.
Mm,
So I thought it was really great thing. So then I was connected to this guy, Matt, who was he's done some horrible stuff. Anyway, so he's a great writer. So sorry about that. Playboy wanted to write an article about it.
mhm.
So he went through the procedure. So they called the gut shot. So if you go on my website, dr.eugenelipov.com, you can actually read the Playboy article.
Saw that. That's
It's
why I said I know, because I saw where it was attributed to.
that's funny though. I think it's just hilarious. I just the funny thing is for me to be in Playboy, it's like that's
Yeah.
interesting right there. But they did a beautiful job fact checking and everything else. And I am surprised how little pushback I've had on that title so far. But
Well,
I love the changing life concept.
the reason I ask, like, yeah, I think the belief in God can be a somewhat divisive thing, but I feel like it is a necessary component of true healing to have some faith in something beyond oneself. Whatever that looks like can be unique to each person. But that's why I was wondering if you feel similarly, if having some sort of spiritual belief or faith in God is necessary for this, and that played into the title at all.
Well, I quoted somebody else. So,
Sure. Sure.
but B, I am a huge believer. So if you look at Freudian writing, he talked
Mm,
about oceanic feeling. If you are just an entity and your life has no meaning, you're going to be a miserable person when you die. I feel like I have meaning. And like, for example, every time I help somebody, I feel like my mother is patting me on the back saying you've done a good job. I
that's
mean,
nice.
from sciencey kind of guy, it may sound goofy, but I mean, who's to say I'm wrong? We don't know. I mean, ethereal plane, I truly do believe exists. So a lot of people who do psilocybin LSD work, they believe it's there, whether you access it or not, but it's there.
I believe that as
Maybe
well.
they're wrong. I don't know. When I had a psilocybin experience, I was flying through a beautiful universe that was very geometric and gold in a spaceship. I don't know, maybe it's there. I don't know. I mean, I have enough of open mind, and there's a lot of things if you think about it. So here's one of my favorite quotes. So in 1912, some journalists asked the man who was in charge of patents for the United States, and they said, "What kind of changes do you see forthcoming?" They said, "There is nothing left to invent." 1912. Yeah,
That's
excuse me.
awesome.
In 1915, I think some engineer, they asked him about how fast do you think, how fast a train can go? Oh, 50 miles an hour, tops. Everybody will die inside of it. Why we have bullet trains now? So I think what the current accepted dogma of the day is, nah, I think science fiction becomes science. I love science fiction,
Yeah,
but science fact a lot of times will be even crazier than we can imagine. And I think
absolutely.
planes and alternative experiences, alternative realities. I think we're going to see multi-universe. It seems like a real. I mean, it's like computationally it exists. I think with AI, we'll be able to reach there whatever is required. There's been a lot of science fiction things like that. So let's say every time you take LSD, you go into a different plane, which is parallel universe, and your brain is synced to the other person, and that experience of what seems to you like unreality, it's their reality. Who's to say it's wrong? Nobody knows.
I mean, I thoroughly believe everything that you just described. I mean, there's radio waves all around us. We can't
Yeah.
see it with our naked eye. We can develop technology that allows us to see it, a
Correct.
finely tuned sensor. I think mushrooms, LSD, ayahuasca, they can attune your senses to see these other fields that are around us that we just don't
Yeah.
have access
It
to.
may be boosting our sense of we don't call it. I mean, it's not like we used to vision. We used to three-dimensional objects. Maybe there are six dimensions. I don't know. Well,
Yeah,
I do know that I'm looking forward to finding out. But I do know one thing: the brain, the biological part of the brain, soaking it in various chemicals is not a good idea. Keeping it calm, relaxed, you'll be much better playing, right? Because if you start a ibogaine experience or psilocybin experience all wigged out, you're gonna have a bad experience.
absolutely. In our program, this is something, the whole structure of it is based around this. I think psychedelics are non-specific amplifiers. Like it's not a net positive by
Yeah,
itself.
exactly. That's
So
exactly right.
if you have anxiety, you scroll TikTok, you take a microdose and you take caffeine, you now have turbocharged anxiety. We have not
Yeah,
solved anything at all.
yeah. We made
So
it
it's all
worse.
about
Made it worse.
exactly.
Now you
So
know
how
norepinephrine up, you're activating your BNGF, and you're off to the races.
mm,
By the way, the new thing I'm working on, so I did a
yeah,
TEDx in San Miguel 2 weeks ago. It'll be out in a couple of weeks.
okay.
My new one is mimetic disease, which is
Mimetic disease.
means, means creating psychiatric disorders. So my speech, that's a thing.
Yeah,
My speech,
yeah.
what psychologic is biologic. Meaning creates psychological change in the brain that leads to inflammation and create activation of norepinephrine secretion. You actually have real physiological conditions you can measure.
Interesting.
That's what makes you miserable. You watch enough memes, too much interleukin 6 deactivates your muscles. Your muscles, you can exercise, that leads to depression. You know what I'm saying?
I I get what you're saying. It takes me all of that takes me back to learning about various things like this in physical therapy school and wondering if I was just too lazy to trace everything to its actual root and just kind of wave my hand at the biological things and worry about how can I talk to my patient and make them feel better. So that's kind of why I was pushing back a little bit on everything being explained biologically and asking, do you think there's some psycho spiritual component there? Because that's more of what I focus on.
Listen,
But
I believe in that. But think about it, the way you're trained, the way we were trained. Western medicine does not believe in integration. So
no,
if you look at my parents who were physicians in Russia, they integrated East and West there. So they integrated those. That was natural for me. So that's my background.
right.
I mean, look at Eastern medicine, the whole about integration and trying to get the whole body to work together. It's funny. So I was talking to the head of American Psychiatric Association, APA, and he said, "Hey, Eugene, there is a brain body connection." I said, "Yes." He said, "You know what it's called?" I said, "No, it's called the neck."
That's a good one.
Not cute. It's called the neck. And I was like,
And you're like, that's where I put needles. There you go.
it's the brain.
Fantastic. Dr. Lipov, is there anything that you wish people understood better about this procedure? Because the popularity is getting there. The cat's out of the bag, so to speak. You've got the research coming down the pipeline to get this stuff in the hands, hopefully, of more people. What are some things that you wish people understood more about this, or perhaps some takeaways you'd like people to have after hearing this?
The takeaway is that don't give up hope, don't die.
Hmm.
Definitely.
Step one.
I mean, that's true.
Yeah,
Look at biological methodologies, TMS, Stellate Ganglion Block. Look at, psychedelics. The point is, if you're not being successful with current therapeutic, look somewhere else.
right.
Yeah, that's true. If you're going to have Stellate Ganglion Block, make sure people are trained. If you go to Stellar Mental Health, I'm a CMO for that. We have 24 sites, United States, and sites outside the country. Um, but whoever does it, make sure they're trained and they have all the equipment and it's real medical.
Hmm.
If it looks like a hole in the wall, do not get a procedure there, please. Just don't do that. It's not 100%. There is definitely a failure rate. So no, it's not a cure-all. I know everybody looks for cure-alls, but all those things are lies. Anybody who says 100% success rate, no, it's not going to work. Make sure it's basic diagnosis. So before you go through any kind of procedure, check your blood work. You could be anemic, you can have low thyroid, they can all present as something else. Don't miss the basics. You can have an infection, you can have bad kidneys, know what's going on with your body.
Hmm.
I think that's a fair way of looking at it, right? So I'm a clinician, right? So basically, you need to have your body functioning before you can have mental health. And then, do meditate if you can. Stella does help you meditate. Meditation makes brain tissue grow, which is a great thing. Right? Play Tetris, great, great game to improve your brain, reduce PTSD symptoms, and don't give up.
Beautiful. Dr. Lipov, thank you very much for your time. I really appreciate getting to know you. I really appreciate your personality more than I had any idea that I would. Thank you so much for doing this. I could have talked to this guy all day and probably bothered him with 1,000 questions that I wanted to ask, but he was in the middle of having some work done on his house, and we got interrupted a couple of times. And I didn't want to keep him all day. The dude was literally coming out of meetings when we started. He was trying to eat his lunch real quick before I hit record, and then he had stuff to go take care of. So I was trying to be respectful of his time and not just bore the shit out of him and you as the listener with a million questions. But I really took a lot away from this conversation. I won't be changing the name of the podcast anytime soon, but I do really appreciate his point of view on um, characterizing PTSD as an injury, not as a disorder, and just kind of the message of hope that he was trying to drive home. Perhaps calling it an injury is actually in line with that. As he mentioned, he's got a nonprofit called Erase PTSD Now that you can check out and support. They're working to help support people to get access to these treatments and promoting the terminology shift to go along with promoting just this idea of that hope is actually out there for people suffering from these types of issues. You can find everything else about him at dreugenelipov.com. It's a fucking great website. Um, just like with this podcast, I'm a big fan of titles where it's like, does what it says on the box. So there you go, dreugenelipov.com. You can find everything out about him. He's got a new book coming out called The God Shot that we discussed at the end there. I think it is available for pre-order right now. It's Tuesday, February 3rd. I think it's available on Amazon for pre-order. By the time you're listening to this, there's a good chance it will have been released. And if you are interested in this stuff, I definitely encourage you to look into getting a stellate ganglion block and seeing if that's right for you. And I would, of course, encourage you to look at using our microdosing program to help with all of the integration needs on the back end of that. So hopefully we did not bore you too much in this episode. Hopefully you learned a thing or two. And by the way, just one little disclaimer I want to throw in at the end here. You hear me mention in that episode, there's a few conflicting theories surrounding the mechanism by which the stellate ganglion block works. My goal here wasn't to like take him to task on his theory versus other theories. Honestly, I wasn't aware that this was even a thing until this morning as I was frantically looking up research papers and trying to read all the literature on this to inform myself to ask better questions. So all of that said, I'm not even sure 1000% that I buy his theory. I haven't read enough or learned enough to know one way or the other to actually judge the evidence. The alternative theory seems to be about more of the like polyvagal theory that the stellate ganglion block is affecting the vagus nerve. I don't see why it wouldn't be both. But everything that he said to me was genuinely new information for me regarding the nerve growth factor and all of the norepinephrine pathways that get affected. So I don't know, I guess, is what I'm trying to say. And I certainly wasn't trying to make an enemy out of Dr. Lipov by like hammering him on his theory versus these other theories. As you heard him talk about in this podcast, he wouldn't give a shit anyway because he's just unfazed by this stuff. And as we also talked about, at the end of the day, this shit works. I don't know that we need to know the mechanism. I certainly don't need to know the mechanism by which ayahuasca works. You know, we heard him talking about this example of somebody crying like profusely for hours after getting the stellate ganglion block. And that's something that I wanted to ask him about more too, is like, why is that? Because there seems to be this purging that occurs. And so is that like a purge in the sense of like how we use that term with ayahuasca. Is that just a quote unquote reset of the nervous system? What does that actually mean? The way that he spoke about it was essentially a processing or a feeling of decades worth of emotions that never actually got felt. And that's certainly in line with the tenets of our program. So I guess all of this is to say, I don't really care what's happening. I care that it seems like we can give someone this procedure. It's extremely safe and it's extremely effective and it's extremely well tolerated. There's not a ton of side effects. You don't have to rely on it forever. It is a one off procedure. It's fairly cost effective. And then you can follow it up with lifestyle change, with microdosing, with good therapy techniques that actually work. And it seems to really fucking change people's lives. So yeah, I'll stop here. I'm rambling. I'm tired. It's the end of the night. Um, Thank you very much for listening. Go look up Dr. Lipov's work. Go look up stellate ganglion blocks. If you're interested in this stuff, reach out to me. I can help you navigate that. I'll probably just refer you to his site and to the Stella organization. I think that's kind of his company. That's the arm of his work that's actually providing these procedures with highly trained people, because obviously that matters quite a bit. So reach out to me. I would love to help you navigate the landscape of all of this, talk about how our work can fit into the integration after something like this procedure. And until next time, God bless you. Take care of yourself. Good luck out there. Stay safe. Thank you for listening. Rate and review the podcast. Subscribe to the YouTube, and I'll see you next time.